My name is Crystal, and I'm a nurse at Hutchinson Health. The opportunities to help people, to meet people when they're maybe at a vulnerable point in their life or a point when they're not feeling well, and sort of change their perception or change the way things are going for them. For me, that's what sort of was attractive about being a nurse. So to become a nurse, there are many different formal education paths you can take. You can start from kind of the very basics as a TMA or CMA, and those individuals can work in a variety of settings. You can be a licensed practical nurse, which is a 2-year degree that you can get from many community or state colleges. And from there, you can even continue on to receive a master's or a doctorate degree in nursing in a variety of different paths. You can even be a nurse practitioner, which is similar to the doctor route, but just a little bit different credentialing and what kind of patients you can take care of. So I have my bachelor's level degree in nursing, and I got that from North Dakota State University. And then from there, the informal learning is constant. A typical day in nursing is usually very atypical. Just when you think that you have a routine or have things down, something changes. I personally work in a field or an area where I help multiple different kinds of patients. So my typical week, if I stretch it out, looks a lot like everything from helping a mom who just had a baby to helping a patient that came into the emergency department, and then going to the intensive care unit to help a patient who is maybe very sick and needs some acute interventions. There are certain things that help nurses be successful, in my opinion. Some of those might be your willingness to learn, because the field is always changing. And also, you have to want to help people. It's very hard to get set in one way of doing something. So you kind of have to be open-minded and just willing to always stretch the way you think about something. And that, I think, helps you be more compassionate towards the people that you're taking care of instead of being judgmental. One of the biggest challenges of being a nurse are those instances where you want to help people, but for whatever reason you can't help them. It might be someone who's very sick. It might be someone who's not ready to receive help yet. And so to want to help people and not be able to is, I would say, one of the biggest challenges. And on the flip side of that, one of the biggest rewards is when someone is very sick or they do have a very immediate need, and you did something to change the outcome for that patient in a positive way, and that happens all the time. It was presented to me in high school that pretty soon hospitals weren't going to accept 2-year nurses or nurses with a 2-year degree, and so to just go and get your 4-year degree from the get-go. And for me, that worked out okay. I know a lot of people who started with their 2-year degree and then began working as a nurse, and that helped them figure out what kind of nursing they wanted to go into and where they really wanted to go from there. And then they could go back to school and kind of take the most appropriate track when they went back, before they had their 4 or more year level degree. So I think that would have been helpful to know when first choosing to be a nurse or what kind of nursing I wanted to go into.